Hi there, and welcome to this bonus module. Endometriosis does not always occur alone. You may have heard terms like adenomyosis, fibroids, adhesions, cysts, and more, or know of someone who had a procedure like a hysterectomy, myomectomy, or similar during an exploratory laparoscopy for endometriosis. Let's take a minute to talk about what some of these terms mean. Adenomyosis is sometimes referred to as endometriosis's evil twin. This condition is similar to endo in that the lesions are the same. The difference is that instead of being found in the abdominal cavity or on other organs in the pelvis, these lesions burrow deep into the wall of the uterus, causing it to enlarge, toughen, become misshapen, and more. The pain can be excruciating, though there are cases where this happens without obvious symptoms. The only way to confirm adenomyosis for sure is to have a hysterectomy and have the uterus biopsied post-op. This is an extreme step, but it can be life-changing for someone dealing with the life-altering symptoms of pain and heavy bleeding. Hysterectomy is the removal of the uterus. If it is a total hysterectomy, the cervix, or the part of the anatomy that connects the uterus to the vagina, is also removed. The space is sewn shut into what is called a cuff that seals off the abdomen and pelvis from the vaginal opening. Sometimes people get confused by the term hysterectomy and assume that it means removal of the ovaries as well. That is technically a separate procedure called an oophorectomy, and it can be done unilaterally, meaning one ovary is taken out, or bilaterally, where both ovaries are taken out. Know that if the ovaries are both removed, you will be in immediate menopause, called surgical menopause, as soon as you wake up from the procedure. This immediate stopping of hormone production can be jarring and needs careful consideration and planning for, especially if you are younger than the average age of natural menopause. Removal of the fallopian tubes is also common and is called a salpingectomy. Approximately 70% of ovarian cancers develop in the tubes first, a factor to consider if it's a concern for you. Tube removal is also a permanent sterilization method, replacing the previously common tubes tied method, as removal has the same effect while reducing cancer risk. Fibroids are non-cancerous muscular tumors that grow in or on the walls of the uterus. They can be very small or very large, cause pelvic pain and pressure, alter the menstrual cycle, and impede fertility. While some may choose hysterectomy to deal with fibroids, it is not the only option. If you wish to preserve your fertility by keeping your uterus, you can have what is called a myomectomy, a removal of the fibroids from the uterus. Unlike adenomyosis, which is burrowed deep into the walls of the uterus and therefore inaccessible to be removed, fibroids can be accessed as they are found inside the uterus. Fibroids can sometimes have a high rate of recurrence, so you should know going in that myomectomy may need to be repeated if the fibroids come back. Cysts are fluid-filled sacs that most often appear attached to the inside or outside of the ovaries. Chocolate cysts are cysts that have become filled with blood. The name refers to their appearance as the blood turns darker in color the longer it has been present. Ovarian cysts can rupture or burst on their own. If they are small, this can cause pain but relatively little damage. However, if larger ones are left untreated and rupture, it can become a medical emergency. Cyst removal is called cystectomy and is very common in conjunction with endometriosis excision surgery. As an alternative, a cyst may be drained, especially if removing it is difficult or could affect other structures. However, recurrence is more likely with that choice. Cysts are often seen on scans, so you should be able to talk to your doctor about your options before surgery. Finally, scar tissue and adhesions are often mentioned in connection to endometriosis excision surgery. While the exact reasoning isn't fully understood, sometimes scar tissue forms around areas where endometriosis lesions are found. This can become adhesions, which are sticky, abnormal bands of scar tissue that form between organs and fuse them together. Adhesions keep organs from moving around and contracting normally. This can have significant impact, especially on the digestive tract that relies on free movement and the ability to contract, such as the colon and rectum to have normal bowel movements. Adhesions won't be seen on typical GI tests like colonoscopies, but can change the way the GI system works. Having these adhesions removed or cut down, which just means disconnecting the adhered organs or structures, can restore a lot of function back to the abdominal or pelvic organs. It is typically standard during an endometriosis procedure if it is found, but talk to your doctor to find out what their operating procedure is. The more practiced and specialized your surgeon, the more likely they are to know what to do if something like this is found during your procedure. So keep that in mind when choosing your surgeon. This is not a complete list, but they are some of the most common things that come up. Know that unless there is a life-threatening reason for these procedures, such as the possibility or confirmation of cancer, that all of these are considered elective, at least at the time of this course creation in the United States. That has implications for insurance coverage, so do your due diligence and find out what to expect beforehand. You will have to ask your surgeon to perform any or all of these procedures, just as you had to ask them for the endometriosis excision in the first place. Do not assume that anything will take place during your surgery. Discuss it with your doctor first and make sure that what you have discussed makes it into your consent forms. If a procedure is not listed on the consent forms, it will not happen. That being said, there will likely be a clause for emergency care, but this will only cover just that, emergencies. I hope that your endometriosis excision surgery goes well and that it results in your continued health and wellness. You deserve a life free from pain. Be well, and thanks for choosing Zelda Health and Wellness to support you as you prepare. Goodbye for now.